And she offered, hey, I'm a breathwork teacher. Would you like to have a breathwork session? And then we all said, yeah, why not? And I think the most unique was the hands for me. Like I couldn't kind of open them. They're like really cramping. And I was sobbing. Like I was crying so much. And like I didn't really know what was happening. I just, let's say you have a boss at work, maybe, you know, like just arguing, maybe it's like a very difficult person to deal with or so. It could potentially be that you even, or that someone might even develop a hearing disorder because of that.
Hello and welcome to the podcast, Telar Maestro. I'm Emmanuel Ayala. I'm the host of the podcast, and I would like my guest to introduce herself.
Hello, Emmanuel. Thank you for having me. I'm Astrid Klapetz, and I'm getting licensed as a therapist right now, as an alternative health practitioner in Germany.
Yeah, I'm super interested in this, you say, discipline of medicine because, as far as I know, in Ecuador, I don't know in other countries in Latin America, my guess is similar. There is not a certification for this kind of medicine. Can you tell me a little bit about this?
Mm-hmm. So in Germany, we have like the academical route, which is like with the whole university system. And then at the end of that, it would be like a training, which is around 3-4 years. And then officially you're a clinical psychotherapist. Alternatively to that, though, we have this kind of alternative way, which I'm doing right now. And it's kind of like a certificate, like a license that you're allowed to give therapy, but all the methods you have to learn like from different trainings. So it's not like a university which teaches everything all together, but it's kind of like you have to pick your methods you want to learn from different schools. But officially, there's this one in the whole Germany, one certificate that you're allowed to use the methods as a therapist.
So how many years did you study the academic side, and how many years is the last part when you study what you want to study?
So with the academical route, it would be like the bachelor master system, how we do it in Europe. And it's approximately 5 years. And then the additional training, the clinical training can be like 3 to 4 years probably. It depends where you do it, in which pace, maybe specialization. Sometimes it might be like something additional you want to do. It can definitely extend as well. It's also highly costly. So that's what people also think about, even though they have like the academical background of the masters, which you would need to get the clinical psychotherapy training. There's still people who consider if they should go the alternative route, just because a high amount of money and input you have to get into that. And the one that I'm doing, the alternative one, do you mean?
Yeah, what do you mean by input?
It's like, I mean, to be able to pay for it, of course, you can get a loan or something like that. Okay. But there's also like you need to have a certain amount of therapy sessions, of therapy experience to be able to get that. And it can be a lot overall to be able to achieve it. And the alternative can be really attractive sometimes as well. So I think it's really individual what people wanting to choose.
Yeah, and why did you decide to go for the alternative side?
I think personally, like it's also like a time was like quite a long route to do the bachelor's, master's, and then the training of a few years or the financial input. And I think it just started a little bit later in my life. I would say that have been wondering in the last few years, should I still go that path? So I think time was it was a difference, and also I do have to say, like in the regular bachelor masters, it's not really about the therapy or like diseases, mental health issues, what I'm primarily interested in. I want to do practical work as soon as possible, of course, with the right amount of knowledge. But I think combined with that it's more about statistics and studies in the bachelor's master. I think a good amount of reason was that for me to go to the alternative health practitioner. Also to see the benefits of that as well. In terms of I'm having, like, in some ways maybe a bit more flexibility, maybe I would say, in some ways. Like I'm going to do it self-employed, and I mean, I do have to say, if you do the clinical psychotherapist one, you can be also very flexible as well. But I think there's still like a little bit of different thinking about it, where you think you have so much of the long university background. You might want to have a job which is in a clinic or in a hospital, like really, like the kind of maybe standard way in some ways.
Also, so people who want to be more freelancer in that way that choose this path.
Maybe
No, it's not freelancer. I guess the word is different because having your own space for you to practice is different. I mean, having your own, I guess. I wouldn't say clients because sounds. It's a different wording, I guess. You don't say clients or.
We can say clients, yeah, for sure. Patients, clients. Yeah. And if I might add, also with the, I guess it's what I meant with flexibility as well. Like sometimes with the methods, like with the clinical one, you have like the methods which you have been trained. And when you get the patients, which are usually covered by the health insurance, if you have the clinical psychotherapist background, there are just certain methods that you supposed or like allowed to work with the patients on. Whereas when I'm having my background, of course, we definitely have restrictions, but and we have many laws for us as well that we like have to be careful, knowledgeable to treat these patients or to work with these patients. But there can be like a little bit different methods compared to the clinical one.
For me, it's super interesting because I know that there are people in Ecuador or even organizations that do alternative therapy, but I don't know if they have a previous academic training. And this is super useful because then you are in between the academic side and the scientific method and the part who is you already told me that you have a little bit more experience. That is a little bit more the unknown methods and being tested, and this is close related with the spirituality. Can you tell me a little bit about this? You told me that you have a background also in spiritual practices.
I think that has been always like really interesting for me, like exactly how you say the unknown, right? Because there's like so much more that we're not aware of. We don't know. Also in like psychology and all the science, like we actually still don't know exactly where depression comes from, for example. So there's so much like that we like just don't know. The science is not there yet, and it probably will take a long time to be there as well. And also but also about the unknown, we don't know so much, right? So I find it really interesting to be open to that, at least, to not really only constrain yourself to the science background. Yeah.
For me, it's interesting what you said about depression because I think I saw some articles that the idea that depression was only a chemical disbalance in the brain is already refuted. It's not anymore the main idea in psychology. Is that right?
From my knowledge, up to date, it can still be. It's still like about the serotonin or like noradrenaline levels, for example. But it can also be different aspects. It can also be that the receptors might work a little bit different in that person's brain, or some socialization part, just circumstances as well. So there are very many different theories, but you could be definitely right that like the maybe the focus is going a little bit away of just the brain part, about just the chemical imbalance in the brain, but also to other areas now.
Yeah. So I read a little bit about that psychiatry, if I'm not wrong, is the part that deals with prescriptions and medicine, but also is even newer than psychology. So
if it's newer than psychology,
I think it's newer, right?
Could be. I would not know exactly, but I would assume so, because that's where the medicine comes more into part, right? Whereas like psychotherapists are not allowed to give medicine. They're not doctors.
Yeah.
So I would assume that, psychology probably existed longer than psychiatry.
Yeah. And for me, this is interesting as well because I will ask you after I give this argument about the background about the spiritual practices or the spiritual the experiences you had. But for me, it's interesting because in in Latin America, at least in communities, indigenous communities, they use kind of prescriptions, but are plant medicines to change the mind, to transform the mind, and but they have a different perspective of these plants because they attach qualities that are more like, if you could call human qualities, like souls. And but yeah, now we use substances that are more isolated and to transform also the brain. And for me, it's super interesting because for sure these substances change the way you perceive the world. And but yeah, I mean, the interesting part for me is that in these communities, it's not only the substance, it's also the spiritual part of that substance, that what is come about. But yeah, this is just a comment of the difference that I can see. But can you tell me a little bit about these other practices you have, spiritual practices that you find interesting for psychological benefits?
Interesting, like where to start. There's so many, right? I do have to say I have been more into these things maybe in my experimental years, let's say, because now I'm feeling like I'm shifting a little bit to the scientific side, although I do love both worlds. I think both worlds have amazing benefits, and I would like to keep that view overall. To find like the right balance in some ways. I think I mentioned the holotrophic breath work to you. Do you know about it?
No, I don't know much about it. Can you describe it?
I'm not an expert in that, but I was a participant when it happened, and I was at a meditation retreat. It was a really interesting, not just meditation retreat, but also also kind of like therapy, like getting to know yourself, the surroundings, awareness. And at one of the days, there was a person who was a participant, and she offered, hey, I'm a breathwork teacher, would you like to have a breathwork session? And then we all said, yeah, why not? So she explained it, and it's basically like the breathwork practice, where I think it was really how she explained it, in a circle. So you breathe in, and kind of in the same speed you breathe out. So it's kind of like a loop, and not like the regular where you let it set and it becomes natural, but a bit more fast and more like one-to-one, in, out, in, out, in, out. And from what I remember, this would change the oxygen in your blood, the oxygen level in your blood. And that can have different effects on yourself. And for me, it was a very unique experience because, as I said, it was kind of at the end of really one long day, and I was kind of half listening, breath work. I was thinking about the pranayama in yoga a little bit. We do some, about this, right? This. It's the maybe alternate breathing, where it's different brain first to you even want to energize yourself or calm yourself, but they're rather, I would say, a little bit more low impact practices. Okay. Maybe for, just before sleeping, you want to calm yourself, or before maybe have important meeting or something like that. So I was kind of thinking, it's maybe along with these lines. So I was just half listening, which was, I'm not sure good or bad, but it turned out to be a very unique experience for me, because what happened to me was, after, I can't tell, maybe 10 minutes. I might be wrong, but I would say along those lines, that I started to, my fingers on my hand started to cramp. and I started to just like my whole body just like really really tenses and really like kind of not knowing what's happening, but really like being I think just really like tense or tight like in the whole body. And I think the most unique was the hands for me. Like I couldn't kind of open them. They're like really cramping. And I was sobbing. Like I was crying so much. And like I didn't really know what was happening. I just felt like, wow, like things come up. And then she came to me and said like, yeah, it's great. Like that's how it's supposed to be, kind of. Like, I guess if it's a bit more intense experience, maybe not for everyone. And then she calmed me and I felt very, very safe and I felt good. But I also asked her, like, what's happening? Because I was just half listening before. I didn't really know that that's can be part of it. So she said that's like the experience to have. So how would you, so it would be like the hyper ventilation part of it, which can be like have many, many like negative side, like biology wise. So in that sense, I think I was a bit glad to maybe not have listened completely, because maybe you have some I don't know, scareness, or you have some worry that it might go wrong. But for me it was a really interesting experience, and afterward I just kind of like calmed down and felt better.
Interesting. So now, from your scientific point of view, how can you explain this?
Well, there would be more biology, I would say, like because that was like the hyperventilation and then how the level changes. So I couldn't tell about that part. It is being used so as like a therapy kind of way to, I think, just to like get emotions out which you might have had like suppressed before, or which were hidden, because I didn't think I could sob that much in that moment, and I didn't really know why. But we have so much like stored in our bodies, like so much like tightness or like emotions, and that we're not aware of. So for my thinking now, from my what she has explained, or what I've heard from others now, that is like a bit the aim of it, to get it out.
Actually, I wanted to ask you about this, what you said about the emotion stores in different parts of the body. I heard that from a friend of mine. She was taking therapy, but it makes a lot of sense. I mean, I had experience with plant medicines with these communities, with shamans, and something that was surprising for me is that I had to focus on some part of my body, because the emotions were basically, my mind had to focus in this part of the body automatically. I didn't do anything. It's not that the person and the shaman told me, you have to focus on this part. It's just automatically the plants did that. But for me, it's super interesting, this concept of you have emotions stored in part of your body. Is this already something that the psychology community agree on?
I think it's great that you address that, because that's a little bit how things are evolving now as well, with Dr. Levine, which you might have heard of, or Gabor Mate.
Gabor Mate, I heard
Probably,
only,
yeah, I'm sure. That's like at least in some fields, from some people, some perspectives, it goes more in the direction like, hey, let's look at the body as well, not just at the psyche, not just at the brain. So definitely it makes very much sense, right? That you had like different experiences in different body parts, and it says like also in Chinese medicine, right? It's like different body parts belong to different organs or moods. So I think in some ways there is a bit more trend in that direction, and maybe a bit more, aim to understand more as well.
So, but are there research already coming, or already on that has been done so far from it?
Definitely. The magic experience is like a big one right now. So this is like the with the somatic experience that you want to. It's quite trauma focused, like at the treatment for the people. so if you experience some kind of like unique experience in life, which was very hard to deal with in that moment, and you have not been able to like fully process it, like maybe in car accident or something like that, it could be very likely that that you will, like, some parts of your body, or many parts will like kind of store it, like kind of tide it, or kind of have these emotions set. And somatic experience is focused on that now, and there have been many books about it now, many like trainings, courses, that you focus on releasing these parts again, and then you can, like, as a very normal human experience, just process it.
Yeah. And what happens if you don't release these emotions? Can it become chronic, or turn into a disease?
Absolutely, yeah. So if we, for example, stay with the car accident, it can definitely develop to something like post-traumatic stress disorder. So if you, maybe afterwards you might have difficulties like driving a car, or like being next to somebody who drives a car, but it can also lead to a little bit more unaware situations. Maybe you're getting like more easily irritated about loud noises, or maybe, watching if somebody's behind you, so just because you had this experience. And that can definitely very well be for the rest of your life if you don't get it treated. And that's what actually happening a lot, that we had, everybody probably had, how many of these great people saying of had some sort of traumas, like smaller, bigger. So but we often don't know, right? Often don't know, like, why am I getting irritated by that? Why is Emmanuel not getting irritated? Why is it me, right? Yeah. And that's why I think just therapy overall, also coaching, you don't have to have like a big difficulties in your life, but it can be so useful for everyone, just to get to know yourself better and the people around you as well.
You said that there is for sure psychological consequences of these emotions stores in different parts of the body, but are there physical consequences as well for these emotions? Like, I mean, for example, I seen that the rates of autoimmune diseases have gone up in the last 30 years. Also, I saw that cancers risen also from people who are below 50 years old in the last years. So I'm wondering, is also this is there is a connection there.
Mm-hmm. Yeah, it's great. I love that topic as well. For sure, it's like the psychosomatic combination. It's like, when we think about it, like, we might often think about pain in that sense, right? Like, some people might have like some pain somewhere, but they can't quite say where it is. For some people, it might be even floating in the body. And
Wow,
maybe,
that's interesting.
have you heard? Do you know?
No, this is the first time
Okay.
I heard. I mean, I thought when you said that there is stored in the body, some people get, I mean, I guess myself included, when I get stressed, there is a knot in your, maybe in your back, but that it moves around the body. That's super interesting and shocking as well.
But these people have difficulties, right? Because when they go to the doctors, like, I have like pain in my, I don't know, hips, but then I also have like the upper back sometimes. Sometimes I have digestion problems. Then I feel tired. Like, it's really difficult to grasp, right? Because it's like okay, it's, you don't have something specific, right? And then there can be that. I mean, of course, there's like a lot of like doctor like research, or like not research, but like how do you say it? Like doctor treatments, or they try to find where the issue is, right? But if people look, and often these people, it can be extremely frustrating, because it's like pain, tiredness, or maybe skin. It can be many things, and if they don't find somebody who can help them, it's a very common thing that they do kind of like the doctor hopping. So they go to one doctor, to the other one, just to find the issue, because it's really like maybe restraining them for life.
I actually wanted to talk about this practice. I talked about this with my last guest, one of my last guests, about there is a practice in Ecuador about using the egg to rub the body of a person because this person is feeling bad, feels under the weather, and I don't know if this has something to do with what you said to describe these story emotions, and who knows what the egg might do. Yeah, I mean, I used to dismiss all of these things, but the more what you say about these methods sounds I stop being like, okay, this is something that is only matter. You can say, okay, I can see this and I can describe it in a scientific way. But and actually, I wanted to ask you this part: how do you people or our scientific community describe this phenomenon?
If you have like some physical experience, but it's not organic, you mean it's not it can't be found in the
That these emotions move around the body.
okay. That was as an example. So it would be called like a psychosomatic disease, if I translate it right from
Yeah.
the German one, psychosomatic.
I heard about it actually, but I mean, this is the first time I heard that it travels around the body, and but is there is an explanation and why it travels around the body? And
I think it's more about like, again, just as an example, like because it is not organically, or as far as we know now, that there can't be something bodily wise found. So because of that, the psych is not like maybe saying, right, so if you have like a broken elbow, of course, like the pain would be around the elbow, you would think, overall, right? But if you have like, maybe there's more in the psyche, something that happened, for example, like a trauma again or so, maybe that's not necessarily connected to just one body part. That's why it's like maybe just changing overall, because it needs to go somewhere, but it doesn't have a specific spot, if you know what I mean.
yeah, but I mean, as the body is, uh, I would say the word full, but maybe there is another word to describe it. Has a lot of connections of the nervous system. Is the nervous system activated by the brain with these kind of somatic experiences, or because that's something you can study?
Probably, right? Like, cause I mean, that I think that goes more on the like the biology part again,
Yeah.
where I'm like, I don't want to give wrong facts or so, wrong knowledge. But it makes sense, right? Because if the psyche is like having some kind of like need to process something what happened, but just psych wise it just doesn't do it. It needs to do something else, which is like a super skill if you see it that way, right? Because it needs to do something with it. So what does the psych do? It changes it in the body part that's called conversion. So instead of like to process something, it maybe will be stored into the body, so you can have like a kind of free up psyche again to live your life.
Okay.
And I think it's super interesting because yeah, maybe there are some things where we're like wondering, okay, why is that happening to me? Why do I live healthy? Why do I eat well and everything? Why am I getting maybe like a like a physical disease like cancer? So of course it's not just the psyche, obviously, right? But I think it is overall interesting to think about it, at least, like how come some people, even though they like physically have been like doing very like good life, but maybe some things happen, or like stress is a massive one, which affects hormones, and but it can be like, it goes a little bit more from the psych side, right, rather than rather than of your lifestyle, or rather of the things you eat or things you do to your physical body. Let's put it like that. So, could I give another example? Actually, I think you might like that one. Yeah. For example, it's not that common as far as I know, but for example, there can be also primary benefits of this conversion when, for example, let's say you have a boss at work, and let's put it like, and the boss is maybe, you know, like just arguing, maybe is like a very difficult person to deal with or so. It could potentially be that you even, or that someone might even develop a hearing disorder because of that. Isn't that cool? It's kind of like, crazy, I think when I read it, I thought it's like, but you know, but surprisingly, it only happens when they're at work. But it is true. It is not, it's not faking it. The people are not saying, you know, not as an excuse, I can't hear you because I have a hearing disorder now.
But the hearing disorder is diagnosed by a doctor, or it's just a feeling?
So that's the thing, that's the tricky part. When there can't be found something, like, you know, ears and everything is intact, but the people are not lying, right? The people are not, they're really like, they can't hear. Then that's the interesting part to dig deeper and to ask, you know, how is the boss? How are the colleagues? And that, there are occasions where it comes out, hey, maybe it's like the conversion again, where the body is protecting you. The body is helping you. The body is protecting your mind, your well-being. So how is it protecting? By maybe shutting down your hear ability when you deal with people like that.
It's
and
interesting,
then, and then that same person can go home, very nice environment, having a good time, hearing is perfect again.
Wow.
Isn't that? Yeah, I think it's really...
Actually, a person I know was under a lot of stress, and she was taking a shower, and out of the sudden got blind for a few seconds or maybe minutes, and she was freaking out, and she realized I had to quit this job.
Wow. Okay.
It was too stressful.
Okay.
But I mean, fortunately, it wasn't for a long time, but yeah, that's super scary.
And she got that realization while she had...
Yeah, this is, I mean, that was like the breaking point for her. But yeah, I wanted to ask, so yeah, we are not sure if this is, there is research done to catch basically the physical outcomes of these somatic experiences. Like you, as far as we know, they are not scanning the nervous system running around. Yeah, but I guess if this is something has been discussed in the psychological community and the medical community, there are methods to help with this. Like this.
For sure, yeah.
And what are these methods?
Probably a big one is like behavioral therapy. Do you know behavioral therapy?
No.
It's like as the word says, it's like how you, like your behaviors, and it has many or it can have many different like sub methods, let's say. So for example, like awareness can be one way, right? If you just focus on like the pain again, also like it's very likely to get stronger. So maybe with like this sort of therapy, you learn to like, hey, my fingers feel actually really calm and amazing. So you shift your mind to maybe aspects which do feel really good. Or you can like also with positive psychology, which has been also rising quite a bit, right? Like you can still have like gratitude practices. Like these grateful journeys have been, I think, kind of like a big boom for a good reason in the last years, right? So where you say like, hey, maybe I'm restricted to my physical pain or my feeling about my physical pain, but hey, I can still do that. I can still see my friends. I can still have some hobbies that I enjoy. So, you know, just shifting the mind, having like some maybe different behaviors in the throughout the day, and like maybe can be structured as well. I think there are many like small things that we don't realize which can have a long or good impact long term wise when we keep doing these things.
So this reverse, this, I guess, way of using the psyche to put in the background these painful experiences, and transforming it to physical painful experiences, and then basically bring back this to the mind, or what is the idea of?
With the like psychosomatic, with some of the like, if we stick with the example with the pain, for example, like you might have to like deal with it lifelong.
Wow.
Like because some, especially if like pain might become chronic, like I'm not an expert on this as well, but I also know from many people, also myself a bit, that is like also when it's like chronic, it's supposed to be chronic. It doesn't have to be chronic, but that's like maybe a different field. But some of these things, yeah, people might have to deal with their whole lifetime, but maybe the level of experiencing them can be very different. Whereas you start with like a wow, from like a scale from 1 to 10, and 10 is the worst, like wow, and 9, like it's really interrupting my life. Like the focus is just on that. I'm thinking all day about it. Maybe with all these different methods that we just said, with the, for example, awareness shifting, maybe it can go from a 9 to a 5 or 4. And that is like already improving life a lot. And it is work, of course, but it can definitely happen. Compared to, for example, with the ear one that we said, or also with your friend that you said with the shorter the second, right? Of course, maybe it's also lifestyle changes. That maybe you talk with a therapist about like what is giving you so much stress, what is giving you like in which situations do you have the hearing disability. So that can also go in the psychoanalytical way, maybe also from the past.
Yeah.
Maybe where do you get triggered, and then having this, and then of course there can also be reversed. It's
I can be reversed.
It can be. It's individual, of course. Overall, the psychosomatic ones might not be that well, like having completely results compared to other, for example, like a phobia. If you have like, or if someone has like a phobia against spiders or something, some of these, mental health issues might be easier and long-term wise better to treat than others. And psychosomatic one is maybe one of the ones which is not as easily treated as others. Let's say it like that.
Yes, so that's super interesting. Another thing I wanted to ask you is the part of the culture that I'm wondering if in these psychological issues and physical issues where culture fits, because as far as I've seen, for example, in Latin America and in Ecuador, people has also the same diseases, and a lot of diseases that are happening also in Europe for sure, and in Germany specifically, like autoimmune diseases or cancer. But I was wondering if the triggers of these diseases can change because of cultural values, and if you have experience with that, since we live in Berlin, that is a super multicultural city.
That's true. That's true. I think it's also very interesting. I would have to say though that from my experience, that like in the end, like we're all humans and we all have like the same systems, like how we, everybody has a need of control, everybody has a need of having physical interaction, socialization part, like they're just human traits that everybody has. So let's say like usually everybody, like there of course always like some uniquenesses. So I would say it's actually quite common, like that people are actually in the end really similar. That is like maybe somebody from Romania can be having similar things that somebody from US or Ecuador or like I think it's really really yeah overall really more balanced that people might think.
So I will put you an example, and this is a fun example maybe. I I didn't realize until I came to Germany that dancing was something important. I mean, in Latin American culture. Maybe this is the stereotype, but I was used to the idea. Okay, you go to a party and most of the people dance well, and they have a good rhythm, and there is always one that dances amazingly well. And I mean, when I was a kid, I didn't dance that well. I didn't dance great. Now I think I dance good enough. But when I was a kid, I remember this feeling of, oh, I don't dance that well, and people dance well here. And I imagine that's something that people in Germany doesn't experience, because here as far as I have experienced, uh, if you go to a Paris, people don't care much about dancing. Not a lot of people don't dance that well.
You might be right. Yeah.
Yes.
How about the good dancing, maybe?
Yeah, about the good dancing. Yeah, but I'm using this example just because the part of feeling bad about this is a cultural part. I mean, someone in Germany wouldn't have that.
Absolutely. Wouldn't you say so? Like, okay, so now it's about the dancing, but like, wouldn't you say, okay, maybe a German has something about, I don't know. Let's take another stereotype, like about the, I don't know, punctuality, taxes, the organization or something.
Yes.
Wouldn't you say it's just a bit shifted? That is like, it's just a different topic, basically.
Yeah, but also, yeah, for sure, it's a different topic, but the topic is important for the person who is experiencing this psychological issue.
Right. Thinking about like the therapy though, like how would you do it? Like, of course we might, or like how I would do it. Like, surely we would talk about the dancing part, right? But we're not gonna solve it in the dancing. We're not gonna like we're going deeper. We're going to the humanness of it and say like, okay, so why is it like?
Yeah, by the way, I don't feel bad about dancing. I enjoy dancing, so it's
okay, perfect. Great.
Yeah.
But yeah, so we would just dig a bit deeper, and then usually things would come up as like, oh, I don't feel as good as the others, or like I don't feel as like enough is like a big one, right? Like I'm not feeling enough, or I can't compare myself. And then these ones are not necessarily related to the dancing anymore, right? Because if somebody might be extremely just confident, or kind of like the word of having a very good feeling of self-worth, like everybody has like a feeling how they see their own self-worth, right? Which is sometimes used synonym with like self-confidence, which like in my opinion they're like some slight differences. But anyhow, it's like if somebody has like a really strong one of that, maybe that person might actually not care so much about them. Maybe they would actually think like, I'm a great dancer, or like, okay,
Yeah.
maybe I'm not as good as the others. It doesn't matter. Like, and I would definitely agree that is like, of course, like the themes, the topics are like shifted from cultures, right? And maybe problems can arise maybe in some country more about the socialization part, in other country more about the career part, for sure. The root of it all, from my experience, is like usually quite similar.
Yeah, I mean, I agree. I'm not an expert. You're the expert, but from what you described, it makes sense to me. But I still think, I guess, from the point of view of also a therapist, if you are treating a community, and this community has this is similar patterns. You say, okay, this is something that I already understand because I understand this community. So, for example, if you as a therapy maybe you go to Ecuador, I mean, you probably will treat the people in the same way, but also you will find these different themes popping up, and then you have to adapt to those
For
themes.
sure, for sure. I mean, also, for example, thinking about addiction or something, right? Like, yeah, like the opioid crisis or so. Like, yeah, it's not like there are of course some countries like the US, right, where it's like, okay, that's like a really big thing.
Yeah.
So of course, like it differs absolutely in countries and cultures. The root of it again, or like the treatment might be really similar, but absolutely it can really be like everybody deals with different lifestyles with different also different cultural pressures, right? So if
Yeah,
you
that's
say
super interesting
Ecuador
as
probably
well.
has very different expectations of the people than people in Germany.
Yeah, I mean, the cultural part is interesting for me. I was also thinking that the environment also affects how you feel and how you think. So, like for example, I mean, the nature around you. If there are places that have more nature, or maybe the food you have around you. Maybe, for example, in Latin America, there is more for sure food that is I don't know, more variety of food, and people might think, okay, this is different. I don't know. Maybe people will get joy from this kind of foods, and you will say, okay, this. I don't. I understand the idea that the background, culture is. I mean, in the deep inside, is about emotions and how what are the triggers of these emotions. But I also wonder if there is more about culture and that is also is driving people to feel good or bad.
Yeah.
Um, and yeah, and also I wanted to ask you about another thought because I saw a podcast with a psychologist and he was saying that now is more accepted in psychology today that people in can store trauma from generations. Is that something you have also researched?
A little bit, yeah. I think it's very interesting as well. Yeah, the generational trauma.
And but do you know? Do you this is something that has been research paper about it?
I think in the recent years, like like in terms of like research, it has definitely been a bit more focused as well. Yeah.
Yeah. Okay. Yeah. I mean, it's been great to having you here, and I mean, I'm still happy that we discussed all these topics. It was surprising for me. I would like to keep talking to you, and maybe we can do it in another other time.
Yeah, it was so much fun.
Yeah, it was super fun actually. Thank you, and bye everybody.
Thank you so much. Bye bye.
If you like this episode, don't forget to subscribe to the channel and share it with more people. This will help the community of Telar Maestro to continue growing.